Hi everyone. I thought I would get your attention with the quiz material being the name of this lecture, but this is information that's really important for you to know. When we're talking about equine therapy training, there's a lot that goes into it, and you guys have had a great discussion, and there's been a lot of input, a lot of thorough answers, but more of them are based on horse training rather than equine assisted activity and therapy training. And since you're all new to this, I wanted to talk about this a little bit. So equine therapy training, we have a class in that. It is a full semester class. We always start from horse selection when we bring them in to when we're ready to put them into a class. We start with very basic things like grooming, leading. We introduce some toys. Remember that they're never tied when we are introducing things. They always have the option to move away from the object. We'll talk a little bit more about that as well. And those of you who have mentioned natural horsemanship know the approach and retreat method, which is what we're doing with the props and everything that we use in the arena. So from there, we progress to desensitizing in the saddle, long lining, complicated mounts like full lift mounts from the ramp, where they can get pretty claustrophobic. We can have 3, 4, 5 people helping with a mount. And so you would learn all of that in your therapy equine training class. So what I would like to talk a little bit about is that our program has a foundation in PATH International standards. So we use an eclectic approach. So we use a little bit of EGALA, a little bit of natural lifemanship. We don't do any horseboy, but we do probably a little bit of OK Corral and trauma-focused psychotherapy. So there's quite a few things that go into this, but our main foundation is under PATH International standards. And so some of the standards that apply here that you need to know are the following. EQM1 is, does the center have written criteria for the initial screening of prospective equines appropriate for the activity or therapy offered? So what this means is that anybody that that calls in and says, hey, I'd like to donate my horse, this is where you go, okay, we have a policy of we don't accept horses under 5 years old or under 7 years old, that we need a horse that has a temperament of, if you scoring it between 1 and 10, between 1 and 3. What height and build are we looking for? Gender and herd dynamics. There are some centers that only have geldings and some centers that only have mares or mixed. Currently at USU in 2017, we have all geldings for our equine assisted activity and therapy program. We do need to bring in a mare because of offering EAL and EAPs. Having a mare will help with some of the dynamics as well, to demonstrate some of the dynamics. So EQM1 is, do you have written criteria for the initial screening? This is before they've even come in. Now the horse comes in. EQM2, does the center have written procedures for the evaluation of the suitability of new equines prior to participating in center activities and therapies? This is your 90-day trial period. What are you doing? You have to have a written standard, which you've seen the assessment sheet. It's about 4 pages long now. That is our assessment that we have to go through to make sure that they are correct for EAAT. This goes on to say evaluation for the permanent removal of equines that are no longer suited for participating in center activities and therapies. So if we have a written criteria for the acceptance of equines into the program, then what would be our evaluation for the permanent removal of equines? Not meeting those assessments anymore. All right. So some of the things that you have to have in the written procedures is who makes the ultimate decision. We have another form that I can upload for you that has the program director makes the ultimate decision. Who performs the equine evaluation? What specific criteria by behavior of an equine needs to be demonstrated prior to being placed in the program? Standing quietly at the halt for grooming, behaving appropriately for personnel and participants, responding appropriately to participants' aids, etc. Okay. EQM3 is there an implemented equine training and conditioning program that is specific to each equine-assisted activity or therapy at the center? So for every program that we have, we offer EAL and therapeutic riding, and say we offer EAP as well, then we have to have a conditioning and training program for those horses specific to the activity. Okay. So if we are using a horse in equine-assisted learning or equine-assisted psychotherapy with groundwork, we have to have documented conditioning and training for that. EQM5, is there an implemented procedure for the appropriately credentialed PATH International certified professional to do the following? Check for any changes in physical soundness and behavior before each assignment to an activity or therapy. So every day we are checking to make sure that they are sound and that their mind is ready to work. And make assignments and proceed with session as scheduled, or remove the equine, right, if there is any unsoundness or behavioral issues. So those are some of the things that we needed to talk about a little bit more with therapy training. Secondly, why do we train the horses? There are some programs that you've probably heard about that they use the wild Mustangs, and they don't train the horse because they're going to get a faster response, a more primitive response to the stimuli that is coming from the participants. And that works for them. For our programs, we teach that you do train. And one of the reasons is that we have to maintain the participants' physical and emotional safety while they are there. Right? They are coming to us with trust that we have their best interest in mind and that we will keep them safe. And so when we are doing that, this is called the picture here is called the window of tolerance. And we need to keep the interactions in the arena as much as possible within the window of tolerance. When we have an untrained horse working with someone who is unfamiliar with horses, we can easily go above the window of tolerance, increase the stress, and potentially trigger an individual into hyperarousal. Right? In hyperarousal, you're at the fight or flight response. There is no thinking involved there. There is feeling and reaction. And in the window of tolerance is where you have feeling and thinking, and that's where you want to stay. Conversely, you can also overstimulate, stress out the individual enough that they go into hypoarousal and they shut down. They disassociate. Okay. And we'll go into that a little bit more when we go into EAL and EAP. Secondly, we have to think about liability. Every state has, most of the states have the Equine Liability Act. This does not cover you in certain situations. The situations for the Equine Liability Act in Utah states that the Equine Liability Act will not cover you as the owner or trainer or instructor or facility director or owner if the tack doesn't fit correctly, if the tack hasn't been well maintained, and if enough work hasn't been done with the horse to know that the owner should know that this horse will respond appropriately to that activity. So if you use a horse that has not been trained for the activity, you are liable. Okay. One of the things I really liked seeing in a lot of your posts was natural horsemanship. And with that, what we do is we really work on the approach and retreat, and we try to get to the point of acceptance with the horse. When we push it with some types of horsemanship, they'll push it a little bit more. They'll tie the tarp on, they'll tie the ball on, whatever we're working on, and until the horse acquiesces. There is a difference between acquiescence and acceptance, and what we're going for is acceptance. Acquiescence means that they're accepting because they're shutting down. All right. This is usually not a permanent acceptance, and it's not usually a pleasant one. And so what we want is acceptance because they agree that they're okay with it now. So when we do the approach and retreat method, we are going to take it completely away when they show signs of stress, and then go back to the point where they were fine with it and then start again. Okay. right, lastly, I've had a lot of questions on some of the class materials. So just some notes for you guys. The page number corresponds with the week number of your semester. So 4.horses is week 4 of the semester. The week starts on Monday morning and it ends on Sunday at midnight. All of the work should be done during that period. The discussions, the first post should be by Wednesday and 2 more posts responding to others by Sunday. Please remember that saying, oh, that's a great idea, oh, hey, I like your post, is not a substantial post. I've seen some really good ones that have kind of said, well, you know, I don't know if I agree with you there. I like that. This is what this class is about, is trying to figure out where we're comfortable in EAAT, which model we like, what theories we like. Okay, so keep that up. You guys are doing a great job with that. Late work, that question came up. There will be a 10-point reduction every 2 days for late work. I do accept late work up to a point, but you will have a 10-point reduction every 2 days. Please contact me if you need a little extra time. Contact me beforehand and I will not deduct points, okay, if it is a valid excuse. So if you have any questions, please shoot me an email. There will be a quiz posted tomorrow on the materials from this lecture.